Namaste. This is Dr. Anish Behl, Endocrinologist at Apollo BGS Hospital, Mysore. Today I am going to talk about a disease that we see very often, that is diabetes. We are seeing an alarming increase in number of patients with diabetes. This is probably because there is a pandemic of obesity and overweight patients that we see in our population. What is happening is that we are racially predisposed, genetically predisposed to get both obesity and diabetes. Over that, we are becoming more sedentary. And probably we have access to food which is calorie dense. All this is causing a rapid increase in both obesity and diabetes. What is more alarming in our population is that we see diabetes at a very younger age. Onset of diabetes is seen in young patients, probably in their 30s itself. This is almost 1 to 2 decades before the diabetes starts in the Western population. What we can do to keep this in check is probably to become physically more active, maybe to involve in simple activities like walking, cycling, etc. To become a little more conscious about what we eat. Trying to avoid food which is food which is fried, too much of non-veg, snack items, sweets, probably would help a long way in keeping our weight in check and also reducing the risk of diabetes in future. If you are already a diabetic, probably what's more important is to be regular with the exercise, to stick to a meal plan, to take your medications regularly as advised by a doctor, to get the health checks, investigations done on a regular basis to see that all your parameters are under control. If you are not a diabetic, probably a word about when to start looking at the risk of diabetes. If we look at the guidelines of American Diabetes Association, they say that everybody above the age of 40 years should be screened for diabetes. In Indian context, most experts believe that we should probably start screening at the age of 30. And if the tests are normal, we need to do it every year, especially if you have a family history of diabetes. We at Apollo Hospital have a dedicated Apollo Sugar Clinic, a dedicated clinic to take care of the requirements of your diabetes, where we have the health checkups required for the diabetics, a dedicated dietitian, and all the other additional support staff which is required for this. Thank you.